Hello again, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System. Welcome to the 19th edition of our COVID-19 community briefing. A little bit of extra pressure onto me today because it is the 19th edition of COVID-19. It's kind of like your golden birthday, I guess. But anyway, we'll get through this today. And I want to talk a little bit before we get into the scoreboard and some numbers. Just a little bit on why it's important that we are transparent in at least attempting to communicate with all of you with regard to what's going on. Questions like, why we do what we do here in the health system, and maybe on a larger scale, why does the public do what it does on some level. But I really want to talk about here, why do we test patients? Well, obviously, you think it is primarily for the patient. Technically, it probably is not, because as you've heard me say before, the treatments for the patient actually is the same regardless of whether it's positive or negative test. The test is important, though, and it's important to know whether you're positive or not because of how you might affect others, whether it's those that you have been in contact with, your family members, workers, that kind of thing, but also for the protection of healthcare employees as well, to know whether or not we have to go into full PPE, as we say. So it's a little bit maybe different than what you would think in terms of why we test. What kind of test? We covered that quite a bit in our last issue here, or our last briefing. Again, do we send your test to the state because it meets criteria? Do we send it to Sanford Lab because it meets a different kind of criteria? Do we recommend you go to Test Iowa because there's a self-screening test, or there's a number of different steps that we need to step through for that. And then also whether we're doing a rapid test, whether we're doing the traditional PCR test, or even while we go to the IgG, which is that test that we've talked about before, whether you've had the virus as opposed to whether you have the virus. So there's a lot of things that go into that. Questions like, why do we mask? And why do we mask in public, for example? And again, to talk about those things in an environment where you can socially distance yourself from others greater than 6 feet away, maybe there isn't a need to mask. You can stay far enough apart. But if you can't control that, or you don't know, you should wear a mask. If not for your own benefit, for the benefit of others around you. If we mask, what kind of masks are we going to wear? There's N95 masks, there's surgical masks, there are cloth masks, there are cloth masks with filters. All of the above are various things that come into play, particularly as we talk about things here at the health system. Again, the recommendation from public health that we're following in the public is to wear a cloth mask when you can't social distance. Again, the notion of grace comes into mind there regarding if you're in a particular business and you're looked at funny because you have a mask, you just have to accept that. If you're looked at funny because you don't have a mask, you have to be willing to accept that. And so to be able to receive grace and extend grace a little bit is really important, because there isn't a single right answer, again, to these things. But again, the official recommendation is if you cannot social distance, please make sure that you do have a mask. I'm going to come back to that a little bit more, but I want to give you some scoreboard stuff in terms of what's going on in our area. This will be a little bit dated. It'll be as of Friday, and I'll update you later again this week as we get more current numbers. But as of right now, Orange City Health System has done 116 tests. As we mentioned, that number is going to go up, and it's going to go up significantly, not because of any outbreak, but because we are now testing surgery patients, those patients with other procedures. We're testing OBs that come in, and we're also considering testing all admissions now into the hospital as well. And so that number will go up. What we hope will not go up is the number of positives. To date, we've had 11 positives of the 116 tests. So that's a rate of about 9%, which is really amazing that over the course, it's pretty much out there that 8 to 9 to 10% maybe is a normal positive rate on this. So our numbers may be less than what some people think, but relatively speaking, the number of infections are holding right in there at the percentage that you would expect. So by some means, you could say that the criteria for testing is legit, even though it may not meet everyone's personal desires. The negative test then, if you're doing the math, would be 105. So 105 negatives out of 116 tests. Stepping up to the county level, the last number we have from the county level is it was 10 new cases on Friday, 120 cases so far, positives, 120 positives. We are aware of at least one hospitalization in Sioux County, but that's in a non-critical situation. But that's all the information we have on that at this time. I'd like to step up a level from the county to Region 3, which I mentioned in the past. Region 3 consists of 20 counties in northwest Iowa. Is heavily influenced, of course, by Woodbury County and the outbreak that's occurred there, but it's important to understand kind of where we are at the next level up. And so Region 3 has currently 76 hospitalized COVID-19 patients. That number the day before, so I've been on Thursday, was 81. So we had dropped down 5 patients, hospitalized patients in this 20 county region. Of those 76 hospitalized patients, 33 were in the ICU. In Region 3, within the 24-hour period of Friday, there were 9 admissions. The day before, there were only 3. So that actually jumped up, which wasn't a positive sign. We can see these different up and down levels vary from time to time. What we're looking for is a trend line in a larger length of time downward. And so those were the numbers on Friday. Stepping it up another level to the state level, there are currently 376 COVID-19 hospitalized patients in the state of Iowa. Of those 376, 124 were in the ICU. That number the day before that was 128. So actually it it moved slightly down from 128 to 124. By the way, the hospitalizations decreased from 387 to 376 as well. So from the state, little different perspective maybe than what's going on in Region 3. And that's otherwise, as it kind of comes east to west, I think things are changing. But in the aggregate, Iowa looks to be going in the right direction. This statistic is a little bit different, a little bit contra to that, is that in the state of Iowa, in the last 24 hours as of Friday, there were 33 admissions. The day before, there were 31. So a slight uptick in the number of admissions, but significantly down in number of patients hospitalized and patients in the ICU. Iowa then on Friday had a total of 374 new cases for a total of just over 14,000 total, 14,049. Iowa had 18 deaths on Friday. So again, another indication that this is not over. 336 deaths total in Iowa. This is a number that when you say it, the first way I think, oh, it's not such a bad number. It is that 1 out of every 34 Iowans have been tested. You think, oh, that's a pretty decent number. But when you look at it on percentage, that's only 3%. So 1 out of 34 is a 3% rate, and that's the number of Iowans that have been tested. It's kind of a lot of statistics, a lot of numbers. Hopefully they were meaningful to you in some way. I'd just like to transition to a couple things. As a follow-up to our last briefing, there really has not been any change in our testing capabilities or in our approach, although we continue to try to acquire rapid testing and continue to get access to significant levels of both the PCR testing, both the normal swab testing and the IgG test, again, which tells you if you'd had COVID-19, not that you have COVID-19. We continue to work daily, multiple avenues to try to increase our access to all of those sources, and we will bring them to you as soon as we're successful in any of those avenues. I'd like to talk just a little bit, and I'm not going to get too preachy here, but this is just a little bit of an encouragement to use common sense, again, that we talked about the other day, not to live your life in fear. The saying about the only thing to fear is fear itself. That's very true, and I think we need to move beyond kind of where we've been over the last several weeks and really attempt to live our lives not out of fear, but out of common sense, and to apply those common sense filters to all of the things that we've been hearing about. Things like social distancing, hand hygiene, masking, those kinds of things that we've already talked about today. Grace for others, grace for yourself in many respects, and to live your life. But I'm not saying recklessly. I'm not saying throw caution to the wind and go have all kinds of large gatherings and things like that. I'm not saying that. But I am saying don't live your life in fear. Let's get out there. Let's get going with stuff, but use common sense. Mask when you can't, social distance, but get out and about. And I think it'll help all of us, quite frankly, to move forward. That's it for today. Hopefully we will see you a couple more times this week. I'll certainly provide any information that we can. And as a reminder, stay vigilant, stay strong, and stay healthy. Thanks for joining us.